Hi, I'm Jenny Backus, Acting Assistant Secretary for Public Affairs here at HHS, and welcome to our 5th web chat on health reform. We set these web chats up because we understood that a lot of the details of the Health Reform Affordable Care Act can be really confusing. So we're hopefully going to clear up some of the misconceptions that are out there. Since starting this series, we invited you, people watching, to submit your own personal questions on health reform, and we've received thousands of questions to date. If you want to submit a question during our web chat today, we encourage you to do so. Send us a tweet via Twitter, and our handle is @HHSGov, or you can always email us, and the email is healthreform@hhs.gov. If you could, just keep your questions brief so that we can try to get as many answered as possible today. And if it's running long on your question, we may paraphrase it a little bit too. So if we don't get to your question today, there's another place that we're answering questions, and that's on our website, healthreform.gov. And you might find your answer because we do try to get to as many most frequently asked questions there. In fact, we change the question every day and keep a running tally. This week we're going to talk about a topic, though, that's really, I think, gets a lot of Americans pretty passionate, and that's health insurance companies and what this new law will do for people who've been frustrated by them for years. This has been a huge topic of discussion on our website, so we know you're going to want to get to more of the details. We're always honored to have some of the best people in health reform here in our studio for the guest, and thank you for taking some time. My boss, Secretary Kathleen Sebelius, Jay Engoff, who is the director of the newly formed Office of Consumer Information and Insurance Oversight right here at HHS, and Keisha Brooks-Coley, who's the Associate Director for Federal Relations with the American Cancer Society and the Cancer Action Network. So, Secretary, before we get into the viewer questions, and like I said, there's lots of them, it's been a month since we first started doing these things. What have we accomplished to date in a month?
Well, as you say, the President signed the Affordable Care Act just about a month ago, and real progress has been made so far and kind of accelerated beyond the point that we had hoped. So a lot of the provisions in the bill for 2010 aren't supposed to happen until 6 months after the President signed. So by law, not until September 23rd of 2010. Good news is companies have stepped up and said we're going to open up family plans so that young Americans up to 26 can be covered by their parents. So if you have a college graduate this year, your child could stay on your family plan. Just talk to your insurance broker, talk to your employer, and figure out if that option is available. We found that companies who were dropping people's coverage because they got sick, the so-called rescissions, but dumping them out of the market once they got sick. And unfortunately, there have been some stories about companies targeting sick patients, breast cancer victims, HIV victims, to go after them and clean them out of the policy. Companies have said that they're going to stop those practices. A number of the major insurers are going to do it ahead of the law on September 23rd. That's good news. And seniors starting this summer will start to see some relief from their prescription drug donut hole, the gap in coverage. And Jay's part of the early deliverables, so we now have an office here of insurance oversight. And I think one of the things that's happening is shining a bright light on some insurance company practices that have been frankly going on for years is really helpful in accelerating the change in the marketplace.
Well, Jay, tell us a little bit about who you are, where you come from, and what your new office is going to do.
Well, I come from Missouri. I was the insurance commissioner of Missouri for 6 years in the mid-90s. Before that, I came from New Jersey. I was the deputy commissioner in New Jersey. And what this new office is going to do is, among other things, it's going to implement the changes in the insurance market rules that are going to take effect 6 months from enactment. And as the Secretary said, some of the companies are complying voluntarily already. Those include things like banning rescissions, banning annual limits, banning pre-existing condition exclusion clauses for kids, requiring dependents to insurers to allow people under 26 to stay on their parents' policies, things like that. Those are going to be part of the law, as I said, 6 months after enactment, which is that date is September 23rd. but as the Secretary said, companies are already complying with that to some extent. In addition, we're going to be providing lots of consumer information. There's going to be a new website where consumers will be able to get more information about insurance, and we're going to be doing a lot of reaching out to consumers.
I think that website is actually coming in July. Keisha, you work for the American Cancer Society. Some of what Jay is doing is that stuff that you've been waiting. Talk to us about how cancer victims have felt up to now and what this new law is going to really do.
Sure. The American Cancer Society Cancer Action Network has been very involved over the past year and a half during the legislative process leading up to the actual enactment of the Affordable Care Act. American Cancer Society has been working for nearly 100 years to end the suffering and death of people who have cancer. And the issue of access to care has been one that we paid very, very close attention to. And we realized a number of years ago that before we could really make a difference in the people who live with cancer every day and their families, we had to address insurance issues and coverage issues and access to care, which is why we got very involved in the debate. And we're very excited about the law. We're excited to participate in the implementation process and to make sure that people have access to affordable and adequate health coverage. One other piece that was very important to us in the new law is the access that people will have to preventive health services. It was a top priority for our organization because we know that people can actually have their lives saved if they actually have the tools to be able to have preventive services such as life-saving mammograms, colonoscopies, to get the early detection they need. So we're very, very excited to work with the department over the next couple years as this bill is implemented and make sure that people have access to the health coverage they need that we know will make a difference in so many people's lives who live with cancer every day.
I just want to play before we're going to take another topic in a second and then get to questions, but oversight. You're a former insurance commissioner. You're a former insurance commissioner. You represent people who've been sick. How important is that oversight role in the new law? Like, what was the purpose of putting this whole office together? What was the goal when you set out, when the legislation was written with oversight?
I'll let Jay start that.
Yeah, well, insurance has traditionally been regulated only at the state level, and this bill strengthens state regulation, so it continues that system in place. But it also does establish certain minimum standards for insurance companies nationwide, and then in 2014, really, that's when the whole system kicks in, and that's when a whole new set of rules will have the effect of having insurance companies for the first time compete on the basis of price and quality and service, and not on the basis of segmenting the market and selecting out risk, dumping out sick people. So the full system takes effect in 2014, but in the meantime, there are many changes in the market, like no rescissions, no pre-existing condition clause, exclusion clauses for kids, which take effect very, very soon.
And I think, Jenny, one of the things that happens in a state is that often people don't have a choice. And even though they may not like what their insurance company is doing, either because they've been sick and so they can't get another quote, or because the insurance company is so dominant, they don't really have any other choice. What we can do here at the federal level is shine a light. There are companies that operate in many, many states. They may be dominant in states, but that pattern that occurs across the country, so rate increases that cascaded across the country, or companies that were dropping cancer patients in Maine and in Montana and in Massachusetts, where the individual patient didn't know they were part of a pattern, but we can actually watch that occur. So that bright light here at the federal level, the kind of office that's set up for consumer information, but consumer oversight, insurance oversight, to make sure that we're watching companies' behavior, I think can be very, very helpful to people on the ground, can be an additional backstop to make sure if people have bought a policy, they get what they pay for, that companies are actually following the law, and that we're watching to make sure that the companies who don't treat their customers well in this intervening time are not going to be part of the new exchange program when we expand the insurance market.
Would we have seen this the sort of acceleration of the benefits of dependents and the acceleration of ending of rescissions that we've seen so far if we hadn't had a health reform law? Or is this, you think, because we've had, we have a new office and oversight and everything sort of changed?
I think there's no question that Congress and the President saw some real bad practices in the marketplace. Cancer victims, as Keisha well know, could have been paying for health insurance, trying to protect themselves and their families, only to be in the middle of a chemotherapy regime and find out that their money has run out, that they no longer can have the life-saving cure. Too many women, millions, have not had preventive care at all, can't get a mammogram in the first place, can't get a colonoscopy because they didn't have either preventive care, they didn't have health insurance coverage at all. So I think that the framework of the national law really allowed us to then go to the companies and say, okay, this is going to be the law in September. Why don't you step up and make it a practice early on? Why don't you voluntarily keep people on the policy, stop dropping people out of the plan? And the good news is many insurers have said okay.
All right. Well, let's go to some of the questions that we've been talking about. Like I said, you can get to us via Twitter or through our website. I've got a couple questions because we got so many in over the last couple of days. So I'm going to start off with a question from Rohit, and this is going to go to the Secretary or Jay. Rohit is asking about something that was in the news recently as I think today. When will information be made public regarding states' intents to adopt high-risk pools? So first, can you explain what high-risk pools are for people who don't know what that is?
Sure.
And then get to her question.
Sure. A high-risk pool is a pool for people who have pre-existing conditions, because under current law, insurance companies are not required to insure people with pre-existing conditions. In 2014, when the new law kicks in, those people will be treated like everybody else, and as I said, insurance companies will compete on the basis of price and service and quality, not on the basis of risk selection. But until 2014, there are these temporary mechanisms where people with pre-existing conditions can go to get insurance coverage. They exist in 34 states already. The rates are high, though. They're typically 125% or 150% or even more of standard rates. One very important thing that this bill does is it creates a new federally funded program funded with $5 billion to insure people throughout the country who have pre-existing conditions, and the rate for these people will be a standard rate. It won't be a surcharged rate. It'll be a standard rate. So it's a temporary program, but in the short run, it's a very, very important program and can bring a lot of relief to people who have pre-existing conditions.
Is that something that cancer victims who, I'll just go to Lester from New Hampshire said, can you please address WellPoint's cancellation of policies for women with breast cancer? So are high-risk pools a place that people who've lost insurance can go to? And then getting into the specifics of Lester's question, too?
Sure. On the issue of the high-risk pools, I mean, that was something that we paid very close attention to in the legislation, and we're very excited to start to work on getting it up and running over the next few months. And we know that there are many people who have cancer who will be qualified to now actually get coverage under the higher risk pools, and many times this will be the only way they'll be able to actually get the health insurance coverage they need, because in the current marketplace they haven't been able to get it.
Here's another question about high risk.
Lester wants to know about targeting women with breast cancer. The good news is that's illegal under the law. Probably has been illegal all along if it could have been proven, but no longer will insurance companies be able to drop people who have paid their premiums at the point that they get sick. And that piece of the law is not effective until September, but companies like WellPoint and others have stepped up and said, we're going to actually put this in practice earlier. We're going to start in May and make sure that we no longer will cancel the policies of people who have been sick.
And that was what we were talking a little bit about earlier with the rescissions. That's that practice, right? Canceling is rescissions.
Right, and the rescission issue is one that many cancer patients know well. The American Cancer Society has a National Cancer Information Service, which is a resource that people can call and get information when they found out they've gotten a diagnosis of cancer. We've had a lot of people from across the country who have called and let us know that the rescission practice is one that they find themselves having to deal with when they have a diagnosis of cancer, they're in treatment, they're decided that their policy is going to be canceled, and they at the moment when they're actually trying to focus on actually getting the treatments they need is when they find out that they're actually going to have their coverage canceled. So we were encouraged to find out that a lot of the insurance companies agreed to implement this new prohibition early, and we think it's going to make a difference in a lot of people's lives.
All right. Christine, we're going to jump back because rescissions and the high-risk pool seem to be the very popular topics here. We'll go to Christine from Utah. And Jay, maybe you can help us here. I am told no insurance will touch me due to a pre-existing condition. No doctor's visits, no meds. I've been paying my doctor cash. I can afford that, but not the medication. I read that a high-risk pool for insurance will be available this year for people with pre-existing conditions. What steps do I take to participate in this program?
Well, in many states already, there is a high-risk pool already set up, although, as I said, the rate is pretty high. One thing you can do is to call our state insurance department. That's for the existing high-risk pool, and they'll have information as to how to get into that. In addition, the new high-risk pool that's being set up under the new federal bill with federal funding will be established very soon, and the state insurance department will also have information about that, as will we here at HHS. So she's really potentially has two options. One, the existing state high-risk pool, although the rate is high, and another with this new federally funded option. I should point out that that can be implemented under the law either by the state, or if the state doesn't wish to do it, then by the federal government. But one way or the other, there is new federal funding for people with pre-existing conditions.
And that's going to take a couple months to set up, but it's on the way this year.
No, this year, no question about it.
Okay.
And again, that's temporary. The full system where people with pre-existing conditions are treated just like everyone else, that kicks in 2014.
Okay. Bob has a question. Again, Jay, anyone can take this. The day after health reform was enacted, my health insurance premiums went up 16%. I cannot afford $800 per month for insurance as I have no income. I tried to switch to a catastrophic plan, but due to pre-existing conditions, cancer and high blood pressure, I was not allowed to switch coverages. When will I be able to get exemptions from pre-existing conditions under health reform, and how much is it going to cost?
Well, Bob, I'm not sure we can tell you how much it's going to cost right now. What we can say is that we've got some steps in the bill. So the high-risk pool, which we've been talking about, may be in operation in your state right now. You need to call and see. There is likely to be a new option available within a couple of months, and that will be clear for people who don't have coverage and have a pre-existing condition. And states will have some flexibility to decide who that is, some flexibility to say, is it only cancer patients, or will it apply across the board, or what the limitations are. So every state may look a little bit different. But by 2014, all the rules change for all the companies, and no longer will pre-existing conditions be a barrier to buying insurance. Everyone in the new exchanges will have a choice of at least 2 plans, maybe more, and the rules will change for everybody. So there'll be a new marketplace where people who are sick no longer get moved to the side, and they'll be pooled with people who are healthy, and all of us may be an accident or an injury or a diagnosis away from being in a sickness pool. And part of insurance is about spreading that risk. Some people need to be sick, some people are healthy, and that's why you buy insurance in the first place.
What about some of the rates that Bob was talking about? I read leading into the passage of the legislation, there were exorbitant rates, 39%, 59% by some insurers. Are we seeing a difference on the rates, and what can the new legislation do about that?
Well, one thing that we're very pleased about is that one of the large companies that announced a very big increase several months ago, an increase of up to 39% for people in their individual policies, announced that voluntarily they were going to take that increase back. They weren't going to impose that increase, which was another very good sign of companies stepping up and voluntarily complying with the bill, with the new law. But over the long run, I think one of the most important sections of the bill is what's called the medical loss ratio section of the bill. And what that does is it requires insurance companies to spend the money that they collect in premiums on health care and not on overhead, on administrative expenses, on commissions, on executive salaries. Specifically, it requires companies in the individual market to spend 80 cents of the premium dollar on health care, and in the small group market to spend 85 cents of the premium dollar on health care. Many companies are already at that level, but some companies aren't. And what the bill would do is really to force insurance companies to become more efficient, and so that more of the premium dollar goes to health care and less goes to administrative overhead.
Okay. Carol has a question, and maybe we'll start with you, Keisha. Can you advise if breast reconstruction will be covered if a mastectomy is performed due to breast cancer?
I think that issue is one, of course, that many women who go through who have breast cancer and have the treatment that they go through will have to deal with. And I think that's an issue that will have to be dealt with in the essential benefit package when that's actually decided before the exchanges go up in 2014. So I think that's something that I know that our organization will be looking at, and it's a benefit that many people will need, but I think it's probably going to depend on what actual insurance package they have and what the essential benefit package will look like. We're working very closely during the implementation process to look at these issues from the patient perspective and hope that we see actual insurance packages that address many of the issues that are so important to people.
Jenny, I think what we anticipate, much like the market today, is that people have some choices in the new exchanges for some policies that offer less benefits but therefore are less expensive, and others that offer more benefits. So not only will there be a lot of discussion with doctors and looking at the science and lots of input to determine what the essential benefit package is that would apply to everybody, but then what is important to add on if people have some additional resources and want, you know, a more comprehensive plan or a lower deductible, what that exactly looks like. But none of those decisions are made, and lots of input from, you know, the advocacy community, from healthcare providers themselves who really know what are the essential benefits. It shouldn't be done by an insurance company bureaucrat. We should be actually led by the scientists and by what people feel are essential benefits for people to have if they have good health care. Too many folks right now have insurance that does not cover good health care.
Okay, well, speaking of, we've been talking a lot about 2014. Julie from Indiana sent us a question, and I think it might even be a Twitter question because it's short. Is it true that as of 2014, anyone not covered by health insurance will be fined? I think we've had this question in earlier webcasts, too.
Well, the way the bill is constructed, there is an individual responsibility component of it. Right now, people without insurance, if they get sick, if they get hit by a car, if they, get a diagnosis of cancer, taxpayers pay for their coverage because they come in through an emergency room door, they access hospitals, and often the unpaid bills are then spread out among the public. So the president felt from the outset that it's important that employers be encouraged and actually have an employer responsibility piece of the bill to offer health coverage, that individuals do the same, and that the public sector plays a role. Lower income working folks will have some help paying for health insurance benefits. And, you know, small business owners, for instance, this year get a tax credit to start to help purchase employee coverage. But there will be an expectation that you have insurance if you can afford it. There may be some who, even with the help, with the subsidy help and with affordable plans, can't afford it, and there will always be a hardship waiver that excludes the fine and excludes the responsibility to buy coverage.
Okay. Jay, Nicole would like you to talk to you about, or ask somebody, but I think it's you. Is there anything in the law that would require my insurance to cover the expense of treatment in case my babies are born premature? I'm very excited about being a first-time mom, but I'm very concerned about the financial complications that might arise from a high-risk pregnancy.
Yes, insurance companies Insurance companies are not allowed to disenroll people. And I don't want to overstate this, but there are companies whose business model is one of insuring only the healthy. And when people get sick, whether they're adults or children or infants, in various ways trying to get them off the policy. And what this bill does is to make sure that that can't occur. So under current law, under the provisions that take effect in 180 days, she'd be protected. And in 2014, when the entire bill, all the rules take effect, I believe the protections would be even stronger.
And in, I think the case she's describing with a premature baby who may have then some medical issues going forward. I mean, some end up being fine in a couple of months. Some actually have medical issues for a while. One of the other features of the bill that hits right away is children with a pre-existing condition. So somebody born with a situation that may require, a heart problem or problem with underdeveloped lungs that may take a while to clear up, or maybe a lifetime of issues. Those children will no longer be able to be excluded from their parents' policies. Current law would say an insurance company could write a policy saying, we're not going to cover the heart defect of your child, or we're not going to pay for the treatments related to the conditions that resulted from a premature birth. That won't be allowed anymore after September in the new law. And that's one of the, I think, great features for parents. They have some peace of mind that their children won't be isolated and excluded from insurance coverage.
We have a lot of questions, but we have one or two more questions about kids, and then I'm going to ask each of you just one or 30-second parting thought. Going from little babies to my 24-year-old daughter, this is Cindy from Ohio. My 24-year-old daughter is in between jobs, and we are currently paying COBRA insurance. My husband gets health coverage through his employer, but we're being told she cannot be included back on our plan until open enrollment in January 2011. Is this correct?
I didn't
in
follow
January
that.
2011. So they know about the new benefit, but they've been told that their plan doesn't have open enrollment until January. Is that change with the new announcements this week with the insurers? I guess it depends on what insurance company she has, right? I mean, maybe we should just simply answer the question of what happens if you have a 24-year-old who you used to pay COBRA for? What is the sort of parameters around the new adult children provisions?
Yeah, 24-year-olds under the law, effective with the new plan year beginning September 23rd, can stay on their parents' policies till 26. But as the Secretary said earlier, most of the insurance industry now is voluntarily complying with that, really effective in May. So right now, or in a very few days, those young adults, people under 26, do have that protection. They can stay on their parents' policies, and that makes a big, big difference, both to kids graduating from college this May, and also kids who would age out, whether or not they're in college, who would age out under existing law, but would be protected under the new law. So that's a very important provision, which is really going to be in effect in just a very few days.
But I think it's important to say, probably check with your own company, with your own policy. We have gotten lots of good news from the major health insurers saying we want to step up, we want to be kind of good corporate citizens, we want to put this into effect early. But I think double checking, making sure that that really covers your situation is important.
Okay, and I think that's good advice for everybody. I'm going to go through and just ask you quickly for 30 seconds. What's one thing that's either been getting out there wrong or has not been talked about enough in the new insurance, in the new Affordable Care Act, in the new law? Keisha?
Sure. I think that I would talk about the prevention provisions of the new law, which we think are very, very important. And people should know that now even if they have health insurance, they may not actually have coverage that pays for the preventive services without a deductible and a copay. And now under the new law, they'll be able to get life-saving preventive services at pretty much no cost, which is very, very important to making sure people can stay healthy and find out about serious illnesses early.
Jay, what's one thing you want to flag?
Yeah, I think it's the cost-saving provisions of the law. Because of the way that the law restructures the insurance market, particularly beginning in 2014, but already with things like the medical loss ratio regulation that takes effect next year, it structures the market in such a way as to force insurance companies to become more efficient. And some insurance companies are efficient, and they can become more efficient. It has the effect of requiring them, of having them spend less on administrative costs, more on health care. So it really does bring down the cost of health coverage.
Secretary, what about you?
Well, I think, again, a lot of times when we talk about what's going to change, we got to start with the notion that if you have a plan you like, if you have coverage you like, if your employer plan is great for you and your family, if you like your doctor, nothing changes. You start with the premise. What we're talking about is changes in the law that will really help people who currently don't have coverage at all, or have coverage that really doesn't take care of their health needs, or find that there are financial barriers to buying their prescription drugs or to getting important wellness screenings. So again, this is not to say that everybody's policy, everybody's plan is going to change. And there's a pretty significant grandfather clause that will keep in place plans. So when we talk about individuals having to purchase coverage, it's assumed that if you have coverage that is currently in place, you probably don't fall under that provision.
Okay. All right. Well, I want to thank you all for joining us today, and I want to thank you all for tuning in. Kathleen Sebelius, Secretary of Health and Human Services, Jay Angoff, the new Director of HHS's Office of Consumer Information and Insurance Oversight, and Keisha Brooks-Coley from the American Cancer Society Cancer Action Network. We hope we got some of your questions answered today, and we'll be answering more questions, like we said, on the web. If you want to come back and watch this again or pass along the webcast to a friend, it's available on demand at healthreform.gov. So we hope you tune in, we hope you browse, and we'll see you next week. Thanks a lot.